Hi, my name is Connie Kulkanis and you're watching the video on treatment principles. In this video, I want to just briefly introduce you to the options we have in managing a patient with strabismus. Later on, we'll talk about specifically each type of treatment option that we have in more detail and see how we would utilise it in a patient with strabismus. Now, the orthoptic treatment principles are often categorised or summarised in an acronym called GOODS. And you can see here, I've listed the acronym: G for glasses, O for occlusion, the next O for orthoptics, meaning orthoptic exercises, D for drugs, and S for surgery. And within that acronym are the 5 options we have in managing a patient with strabismus. And they are in relative order of how we would consider managing a patient. So when we have a patient with an ocular motility disorder, one of the first things we need to consider is, do we need to correct refractive error? In other words, prescribe glasses, or do we need to prescribe prisms? And that comes into the first category of treatment options, glasses. Once we've considered glasses, we then need to consider whether a patient requires occlusion. And what we're referring to here is the treatment of amblyopia. So you always prescribe glasses before you prescribe amblyopia treatment. And we'll talk more about this when we come to amblyopia management, but that is the order in which you should manage your strabismus patient. First glasses, then occlusion. Now with occlusion, we have several options. We can either patch a patient. We could use optical penalisation, which is manipulating the prescription of the lenses to favour the amblyopic eye. Or we could prescribe pharmacological penalisation, where we atropinise one eye so that the patient again can favour the amblyopic eye. So within occlusion, we do cross over back to the glasses option and down to the drugs option, where we might prescribe atropine. So this is where the order of these treatment options are not linear in nature, but are broadly how we consider the options that we have for patients with strabismus. And one more thing about occlusion, we're generally talking about children in this particular instance, because we treat amblyopia in childhood, we're not treating it in adulthood. The only time we occlude generally in adults is if there is diplopia present, and prisms are not an option to relieve the patient's diplopia. Occlusion will clearly relieve a patient's diplopia. So in that instance, we might be considering that option. And occlusion in that adulthood could be a patch on the eye, a pirate type patch, or it could even be an occlusive contact lens, so a contact lens that doesn't allow you to see through it. Which brings me back actually to glasses, where glasses are not the only option for patients. Contact lenses could also be an option for your patient. Moving now to orthoptics or orthoptic exercises. These are prescribed in patients who have intermittent deviations. So in order for you to prescribe orthoptic exercises, you need a patient to be binocular at some point in time so that you can build on that patient's strength of binocular functions. If they're constantly manifest and you can't assist them to become phobiatophobia, then there's very little you can do from there on. The other thing about orthoptic exercises is that generally you do want to correct refractive error and patch your patient or have equal vision or relatively equal vision before you commence your orthoptic exercises. So you should consider it to be a third option after you've considered glasses and occlusion where relevant. Then we have drugs. There's not a lot of options to use pharmacological agents in strabismus, but we'll come to that a little bit later. And generally, most often it is the amblyopic patient who has atropine as part of their occlusion treatment that we use drugs for. And lastly, we have surgery, and this should be the last consideration in terms of managing your patient. So first, you should look at all other options: glasses, occlusion, orthoptics, and drugs where relevant. And then the last thing you will offer is strabismus surgery. Okay, so that gives you an overview of the options that we have in managing a patient with strabismus and the order in which we should think about these treatment options. And now we'll talk more in detail about all of these options and how we can consider them in managing our patients. Okay, that brings us to the conclusion of this video. Thank you for watching.